Diagnosis of herpes, zoster or shingle. The patient gave history of excruciating pain, stabbing pain, which is very miserable and troublesome. Next, the appearance of the rashes, that is clearly indicate viral infection. Herpetic zoster virus or the varicella zoster virus produces eruption in shingle, which is always unilateral, doesn't cross the midline, and may appear in one or multiple dermatomes in belt fashion. This is the hallmark of the disease. Now the blood test is done to detect the type of the virus, to detect the varicella virus, and next we also detect the IgM, that is antibody produced by the body against this virus. Moreover, we can also perform PCR test for detection of DNA of the virus, because this virus is a DNA and double stranded virus. So these are various tests which can be performed to differentiate from the other viral diseases. We study and observe the pattern of the distribution of the rash, which start from macule, proceed on into papule and vesicle one, and its characteristic distribution, which is a diagnostic feature for this disease. Next comes the treatment of the shingle. As soon as the rashes appear over the body, face, around the ear, eyes, neck, trunk, arms, etc., the doctor should start immediate treatment within 72 hours after the appearance of the rash. The result of the treatment is always good and satisfactory. As early as possible, it is started by the antiviral drugs, medicine, to eradicate or destroy the varicella virus. The various antiviral medicine which are used, they are acyclovir, famciclovir, valciclovir. The mostly used is the acyclovir in the form of oral or systemic. I mean, it may be given IV if there is severity of the symptoms, especially in the third phase of the disease, which is called as the post-herpetic neuralgia, which is a very uncomfortable condition and is a very prolonged condition that needs a careful treatment for many years. General symptoms of the disease, constitutional symptoms, that is, there is fever, there is myalgia, arthralgia, nausea, vomiting, dizziness, malaise. These can be reduced by the symptomatic treatment. We can provide antipyretics, acetaminophen, also pyretics, antipyretics, moreover the analgesics, NSAID medicine, paroxin, ibuprofen, diclofenac, potassium. These can be given in the form of pills or can be given systemic, I mean the therapy, intramuscular or IV, according to the severity of the symptoms of the patient. Moreover, when the condition is very dangerous or very severe one, critical, then we can also add steroid therapy, initially for a short duration in the form of oral or systemic, intramuscular or IV injection can be given along with antiviral drug treatment. Next, we have to pay attention to the to raise or boost up the immunity of the patient by healthy diet, which consists of fresh veggies and fruits. Hydrate the patient. Sufficient quantity of water is required. Next is aerobic exercise and reassurance of the patient. Moreover, the local application consists of acyclovir along with zinc oxide, petroleum jelly. All these chemicals, they are available in the forms of ointments, creams, and they can be used for the soothing effects over the skin problem. That is, the itching and the burning of the skin can be reduced. Moreover, when there is post-herpetic neuralgia, that is a chronic condition that needs a prolonged treatment by the medicine and careful supervision of the healthcare providers for several years. It may require surgical intervention that we block the inflicted nerves by local anesthesia, injecting around that nerves, or may cut off the supply of the nerve to that area, which is a very painful one to the patient. So these are the various steps which are taken to avoid the shingle, which is a not a primary disease, but it is a secondary, that is a next to the chickenpox. Only it affect the patients who had chickenpox in their early childhood. So preventive measures in the children's immunization is compulsory one, especially chickenpox vaccines are available in every country that must be given to the children under 5-year age. When there is appearance of shingle, there are shingle vaccine is very effective and available to the elders ones that can also produce the early and the effective treatment and to get rid of the excruciating and agonizing pain of this disease.